maintained. We'll speak to Dr. Daniel Norris Bequin. He's Deputy Registrar for the Kumasi University of Science and Technology. And of course, we will also come in Nkrumah University of Science and Technology, I beg your pardon. And we'll also look at the return of the SHS students. John Sam Arthur will join us from the Bono region with whatever developments are happening there. And then we have clinical time with Dr. Bertha Sewa, infectious diseases specialist, who will be giving us some interpretations as to what determines a person's immunity to wilt. And will take some time. So we'll come to those numbers. Your quick take on this.
It's been so far so good. We've seen most of the universities and the students sticking to the protocols announced by the health experts. But we just heard a report, yes, to be confirmed, that Accra Technical University has reported one.
Get into that. For now, we have Dr. Daniel Norris Bequin. He's Deputy Registrar from the Kwame Nkrumah University of Science and Technology, joining us on the line. Okay, we'll get him on the line as soon as he is ready. Let's use the opportunity to look at our figures for now. What's Ghana's situation?
The total number of people that have been infected by the virus, the death toll has increased from 85 to 95. And then we have active cases at 3,566. We told that 24 are in critical condition.
24?
Yeah, 24. 24 are severe. Sorry, 6 are in critical conditions. 24. Western North region, 82. Northern region, 61. Savannah region, 37. Upper West region, 35. Bono region, 3.
So Bono region has the lowest.
And Northeast, they have the lowest. 3-3.
3-3. Okay, we'll come to the analysis. 055-744-6429. You can join us with your thoughts and your questions as well. We are also live on Facebook at GBC Ghana. We are on Twitter at the GBC Ghana. We're on YouTube at Ghana Broadcasting Corporation. And of course, the website is www.gbcghanaonline.com. We have been fortunate to be joined by Dr. Daniel Norris Bequin, Deputy Registrar for the Kwame Nkrumah University of Science and Technology, joining us. Doc, thank you so much for joining us. It's been a
first week, according to our plan, was supposed to have been used for revision, and then the beginning of this week, that was yesterday, practical examination or assessment has begun. All those students who are eligible are in school, and they are very stable.
Right. Tell us about how you have been able to space students out. What are the physical arrangements that are in place? Can you give us a picture?
Yes. So the students were supposed to be reported at the various halls of residence where we had earmarked to host them.
Right.
And the medical team was there to actually screen them before they were ushered into their various rooms. Originally, we used to have 4 students in a room, but because of social distancing, now we are having to keep 1 student in 1 room.
1 student in 1 room?
Yes. 1 student in 1 room. And typically, by going by the various protocols outlined by the Ministry of Health, the student has to be screened every morning before they enter lecture hall or examination center.
So
each student has received 4 nose masks, 1 nose mask from the university, and 3 each from the government. Regular education, they are supposed to keep the pocket size even when they step out of their halls of residence, they have to come back their hands before they enter. Same with all places where they enter, the lecture halls, the examination centers, the laboratories, everywhere.
How soon are you replacing the pocket size sanitizers when they get finished? Is there a plan?
Yes. The university also produces hand sanitizers. And so, as and when they run out, we will replace it.
Okay. Do you have currently in place an isolation center or a place where you can isolate students who may get infected?
Yes, we have had an isolation reopening. We had another. In all, we have done about 4 disinfections or fumigation, and we did not only do that. We did both the university campuses, the offices, the lecture halls, the various halls of residence, and we extended it to private hostels wherever our students were living.
Right. Okay. So you talked about the protocols that you have shared with the students. I'm sure there was some orientation, but is there a mechanism that you've put in place to ensure and enforce some of the protocols that you have asked them to abide by? Because
Skills lab, wherever the students are entering, we have security personnel there to ensure that these students adhere strictly to these safety protocols.
right. In case of any upsurge or a case, what is the protocol in place to since you are deputy registrar to students, again, as another message to them in this pandemic whilst they are back writing the exams?
So the advice is that they should make sure that they all accept protocols and avoid in town or loitering around. Those students who are not eligible to come to campus, some of them have been forcing their way to come and hang around the private hostels. The university may not be able to monitor that are supposed to be on campus. Those are the medical students, the pharmacy students, nursing students, midwifery students need to take. In addition to their theoretical examination, they are supposed to be on campus. And so if you are not eligible, stay home. Right. And then make use of the online learning program available. It is going so well, and most of the students have a lot of assignments to do, and we are winding up hopefully by the end of June. And so nobody should rush to campus to endanger his or her life.
Right. Okay. Thank you very much, Doc, for joining us. Thank you so much, Oji, and he's giving us a picture, Edward, of what is happening there. They have in touch with the authorities. They have a mechanism there.
So far, well, we've not heard anything from them since then. It's been a while that he tried to get in touch with the people that we spoke to, but he's not able to get through them. We hope that he will come out quickly and tell us what has transpired so far, because we need to know. Once that we are recording cases, because now we have total case count is about 14,568.
And our active case count
is 3,000, around 3,500 something.
But so between yesterday and today, I mean, so the deaths have gone up. Yesterday we had 85 deaths. 85,
yes.
So the deaths have gone up by 10.
Yeah.
In a day, in 20 days. Is this cumulative? Do we know if this is cumulative?
I think so, in a sense that when you listen to the minister, they didn't say it was just within a space of 24 hours. So I think that it could be within from the weekend till this time, because we heard also of a report of the SDA, the medical doctor at the SDA hospital, who passed on. His brother has also passed on. So it could be these are some of the figures that are coming out. I don't think the figures are churned out immediately happens. I don't think so. I mean, 24 hours, it'll be scary, no?
But it's scary, it's getting scary. And we can't even tell if these 24 people are severe.
Yeah, 24 people.
Then we have 5.
That's exactly that's another issue.
But at the same time, we are being told that our situation is not escalating. The active cases we are managing are just